Our topic for today's presentation will be the regulation of electronic cigarettes, also known as vaping. After today's presentation, the viewer should be able to define electronic cigarettes, identify electronic cigarette regulation and laws, identify the stakeholder values and the goals for e-cigarettes, identify the consumers and what they want, identify the advantages and disadvantages of electronic cigarettes. First, let's define electronic cigarettes. E-cigarettes are handheld battery-operated devices that allow users to convert a specially formulated liquid into a vapor, which is then inhaled. This process is called vaping. In general, the specialized liquid contains some amount of nicotine, although certain formulations are available that are nicotine-free. Most vaping liquids contain a combination of propylene glycol, vegetable glycerin, nicotine, and flavorings. A typical refill bottle of the vaping liquid, as seen in the picture below, can contain as much as 720 milligrams of nicotine. It is important to note that although the Food and Drug Administration has approved propylene glycol and vegetable glycerin as a food additive, no such approval has been granted for inhalation of these chemicals. Electronic cigarettes were first marketed in the United States in 2008 as a safer alternative to cigarettes. It is well documented that cigarette smoking is the #1 cause of preventable death in the United States. Many health-conscious smokers have turned to electronic cigarettes either to replace or to supplement their tobacco smoking. And some smokers have taken advantage of the fact that they can use decreasing amounts of nicotine in the vaping liquid to use the electronic cigarette as a smoking cessation device. Other tobacco users have turned to electronic cigarettes for use in situations where tobacco use is impractical or socially unacceptable. By eliminating offensive odors and harmful byproducts of combustion, many have seen vaping as a way to renormalize smoking. Of course, tobacco smokers aren't the only ones to utilize electronic cigarettes. Many resourceful users of marijuana and other illicit drugs have found ways to synthesize e-liquids that contain chemicals such as THC, the primary chemical in marijuana. This method allows the user to ingest these chemicals without the easily identifiable smoke and smell of the natural counterpart. Although sometimes advertised as being harmless, initial studies have shown that the vaporized liquids do contain a significant amount of carcinogens and other toxic chemicals such as formaldehyde. These levels are significantly lower than tobacco products, however they are still present in electronic cigarettes. Next, we will look at the advantages and disadvantages of electronic cigarettes as compared to tobacco cigarettes. Some of the advantages of electronic cigarettes include the fact that they are considered a less harmful alternative to tobacco cigarettes. Their use can decrease or completely eliminate the use of tobacco. It also decreases the amount of secondhand exposure to nicotine and other harmful byproducts of cigarette smoking. The electronic cigarette utilizes a rechargeable battery and an electronic heating element as opposed to an open flame or a hot ember to produce the smoke and vapor. And once the initial equipment has been purchased, the cost of vaping is significantly less than using tobacco products. Some of the disadvantages of electronic cigarettes are that they can be seen as an attempt to renormalize smoking, making it more acceptable to use these products as opposed to tobacco. Electronic cigarettes do still contain nicotine, which in and of itself is harmful to the body. Some users are also using electronic cigarettes to use marijuana and other illicit drugs in public without the scrutiny of the smoke and smell of those natural products. Testing has found that vapor is not harmless and it does contain some carcinogens and other toxic chemicals such as formaldehyde. There is a lack of research as to the long-term effects of vaping on the body. although intuitively they are thought to be less harmful than tobacco cigarettes. The long-term effects are still largely unknown. Lastly, the concentrated amount of nicotine in vaping liquids presents a significant poisoning hazard to children and pets. The Centers for Disease Control and Prevention have reported an increased amount of calls to poison control centers concerning this very topic. Most vaping liquids contain fruit and other sweet flavors in their liquids, which may make these extremely palatable to children and pets. The amount of nicotine available in a typical refill bottle is up to 10 times the lethal dose of nicotine, and certainly enough to cause an acute illness. This graph shows the typical usage of electronic cigarettes. Up to 79% of the users report that they have completely replaced their tobacco products with electronic cigarettes. The theoretical framework used for our discussion today is the theory of reasoned action, which in general states that one's intentions are defined by the attitude and subjective norms. Then their behavior is modified by these intentions. Utilizing the theory of reasoned action, e-cigarette usage is driven by the attitudes and subjective norms. This includes a person or the population's perception of the behavior and the perception of those around us. This can include influential groups that look at health risks and safety issues, such as the FDA and the CDC. It is our hope that these attitudes and subjective norms result in healthier behaviors for our client population. Under the theory of reasoned action, e-cigarette users can also be affected by negative feelings, such as it being unacceptable to smoke in public places, reports of increased tobacco use by decreasing the motivation to quit, encouraging non-smokers to smoke, and increasing the type of smoking that is socially acceptable. Also includes safety concerns such as worries about toxins, carcinogens, and quality control of vaping liquids. Positive attitudes towards electronic cigarettes come from the fact that these devices can be used as smoking cessation tools. There's lack of scientific evidence to negative secondhand smoke effects. There is less risk compared with tobacco cigarettes. There is a potential to decrease smoking-related illness. And of course, the financial burden from using electronic cigarettes is much less than using tobacco cigarettes. We can also utilize the theory of reasoned action regarding the controversy over regulation of electronic cigarettes. Beliefs would be the public and agency perceptions regarding the safety and the need for regulation. Evaluation would involve studies that reflect the outcomes of the use of electronic cigarettes. Is the outcome a good or a bad thing? Does it have negative consequences, but it's an improvement over tobacco cigarettes? And similar questions could be answered. Subjective norms are affected by the opinions of regulatory agencies, laws, studies, as well as marketing techniques. The motivations for regulatory change or for addressing pros and cons of electronic cigarettes include political motivations, tobacco companies attempting to increase their market share and stifle competition, the manufacturers of electronic cigarettes, as well as health promotion. All of these things feed into the attitude or the subjective norm that is perceived, and this in turn encourages the behavior of the regulatory agencies and politicians when looking at electronic cigarettes. As professional nurses, it is our duty to advocate for change in our community. We have to look at the interest among healthcare professionals in the workforce and workplace. We must work with association, political, and interest groups to advocate for policies and health concerns that positively impact our patient populations. We must also be educated in government policy, and we must work to influence that policy in such a way that it creates positive health outcomes. As we advocate for policy change, we must keep in mind that there are no current or very limited regulation of the electronic cigarette industry. They're generally thought of to be safer than cigarettes, although cigarettes continue to be easier to purchase just due to their availability. We must increase nursing research into the area of potential use of electronic cigarettes to decrease or stop tobacco use. We must also become involved in our interest groups, political groups, research, and advocacy regarding the regulation of electronic cigarettes. As nurses, we must also be aware of the social determinants of the regulation and use of electronic cigarettes. We need to assess the social determinants such as financial impact, the access to health care, as well as the education and understanding of risks involving electronic cigarette usage. We must also be cognizant of the individual lifestyle factors that influence our patients' health choices. Our goals in regulating electronic cigarette usage should be based on harm reduction. We should decrease the smoking-related deaths, seek to reduce the occurrence of lung cancer and other respiratory illnesses. We should ensure that we have non-biased and thorough research into the use and long-term effects of electronic cigarettes. And we should encourage regulation of the aspects that negatively impact consumers. In advocating for regulations and policies to impact electronic cigarette use, we must look at the existing laws. Currently, electronic cigarettes are not federally regulated unless they are marketed for therapeutic purposes. 22 states, including Mississippi, have imposed laws that limit access to minors, and 12 states regulate the indoor use of electronic cigarettes. Manufacturers are prohibited from advertising their products with health claims unless the FDA confirms that those products are beneficial to the public health, which would include evaluation of potential harm to users and non-users alike. There are currently no regulations on internet sales, as this would fall on the federal government. The state of New York currently has the most comprehensive electronic cigarette regulation. Statewide, Mississippi has very limited regulation on electronic cigarettes, other than to define nicotine alternative products and electronic cigarettes, which prohibits their use and sales to minors. There are multiple stakeholders in the debate on the regulation of electronic cigarettes and vaping. Some of those stakeholders include electronic cigarette and vaping manufacturing groups, which stand to gain or lose depending upon the regulations. Tobacco companies are turning to electronic cigarettes as a way to recover lost profits from the decreased use of tobacco sales. The Food and Drug Administration, which will be the regulatory body for the safety and effectiveness of electronic cigarettes. The Centers for Disease Control and Prevention, which will ultimately provide funding for research into the safety and efficacy of electronic cigarettes. CASA, or the Consumer Advocates for Smoke-Free Alternatives Association, which is a consumer group which aims to ensure the availability of effective, affordable, and reduced harm alternatives to smoking by increasing public awareness and education. And health care workers, including nurses, who seek harm reduction for client populations. Consumers of electronic cigarettes can loosely be defined as all adults 18 years or older. They seek to have healthier alternatives to cigarettes. They attempt to cut back or stop smoking through electronic cigarettes and other tobacco cessation devices. And many just want to eliminate the secondhand smoke from their homes, cars, and offices. Our group has determined that the current system is not effective in regulating the use and sale of electronic cigarettes for the reasons outlined below. There is currently no federal oversight in the manufacture and use of electronic cigarettes. This leaves the safety and purity of the ingredients left to the manufacturer. While the use of electronic cigarettes for nicotine delivery is intuitively safer than smoking tobacco cigarettes, Unbiased long-term research on the health effects have not been completed. We also found limited current regulations to control the marketing of electronic cigarettes to younger consumers. Our group recommends several improvements to the regulation of electronic cigarettes, including standardized product labeling, increased research on the long-term safety and efficacy. We must also implement these regulations very carefully, as the financial burden of regulation could completely collapse the industry, thereby negating any health effects of the use of electronic cigarettes. Each manufacturer would have to seek FDA approval for their products. If we mirror the current system used in the pharmaceutical industry for FDA approval, the cost of the research and approval would be borne by the manufacturer. The manufacturer would have to submit separate approval packages and separate research for each and every device or liquid that they chose to bring to market. The cost of this process would be economically unsustainable in the current market conditions for most manufacturers of electronic cigarettes. We also advocate the implementation of regulations which limit the sale and advertising of electronic cigarettes and similar products to minors. Our first discussion question is, do you feel electronic cigarettes are a safe and effective alternative to smoking? Why or why not? Consider how you would respond to a client that asked this question in your clinical setting. Our second discussion question is, how can regulations be implemented in such a way to ensure the safety of nicotine products, yet not financially collapse the industry?